I was actually pregnant with my last child when COVID hit. She was born May 2020, and so that changed the trajectory for a lot of things at that time. I went to working from home, and we didn't know if my husband would even be allowed in the delivery room. It was a very stressful time. A global pandemic wasn't in anybody's bingo card, you know, but we have to be prepared for whatever might come, and I think COVID was a good lesson there.
You know, growing up, my whole life when I decided, you know, I want to have kids and be a mom, when I envisioned myself in the hospital room getting ready to have a baby, I always saw my mom there with me, my mom and my husband. And because of COVID, I didn't get to have my mom with me, and that was really hard. Sorry.
It's changed the way we go about doing day-to-day activities. Obviously, especially at the beginning of the pandemic, before any of us could be vaccinated, we didn't really have family gatherings. We had to stop that stuff. My biggest fear was that my elderly mother cares for my son who was in public school, and so my biggest fear was that she was going to contract COVID, possibly from him. So we were very careful. Even a lot of times when Grandma was over, she was wearing a mask to protect herself. I personally thought at the beginning of the pandemic that we're America, we have this, we're gonna get a vaccine, and we're gonna handle this, we're gonna march right through it. But instead, I've seen a lot of infighting and just a whole lot of distrust. And instead of us pulling together as a community and doing what we need to do to protect, especially the people in our community that are immunocompromised or at risk.
The other way was my best friend actually lost her mom due to COVID, and I always looked at her mom as a second mom to me. So when that happened, it really made things sink in that this is not something to play around with. This is real, and we have to take it seriously.
From a small rural hospital standpoint, I can tell you that COVID-19 has had a huge impact on myself, the staff, issues that COVID-19 brings with it. Those are some things that the staff has had to deal with, almost to an ICU setting. So we do not have an ICU at Salem Hospital. My staff had to learn very quickly how to care for these patients. You know, they are used to treating patients and patients going home. I think just the level of loss that they saw, the age of the people that were losing their battle with COVID, people started to understand the benefits to getting the vaccination. So.